Ohio Workgroup, our GROW ECHO, for August 26th. The work for this ECHO is supported by the Geriatric Workforce Enhancement Program, GWEP, in a cooperative agreement with HRSA. Our GWEP is housed at Northeast Ohio Medical University in Ohio, in Northeast Ohio, Ridgetown, Ohio. My name is Margie Sanders, and I will be your facilitator for today's ECHO. The title of today's ECHO is Depression Among Older Adults, Considering the Role of Social Isolation. It will encompass isolation, depression, and older adults. Keep in mind that the format for Project ECHO events consists of an introductory didactic session followed by an interactive case presentation and discussion between frontline providers like yourselves and our expert panel. Before we begin, I would like to introduce the faculty for today's ECHO. Denise?
Hi, my name is Denise Kropp. I'm the Research Associate in the Department of Family and Community Medicine. I'm also the coordinator for the GROW ECHO.
Dr. Jen Drost?
Yeah, good afternoon. I'm Dr. Jen Drost. I'm a geriatrician at Summa Health in Akron, Ohio.
Brandy?
Hi, I'm Brandy Krasnowski from Direction Home Area Agency on Aging and on the GWEP grant.
Tracy? Are you on, Tracy? Tracy Mauer? All right. I'm not sure if Tracy's on yet. Sue Fosnight?
Sue's not on there either.
Okay. Sue Hazelet, I know you're here.
Hi, Sue Hazelet. I'm the project manager for the GWEP grant and nurse on the ECHO team.
Okay, so I'm going to move some of this a little bit, which doesn't want to happen. Okay. So our presenter for today's program is Rikki Patton, who, and I just lost all my introductory information about Rikki. Sorry, Rikki. She is one of our GWEP partners from the University of Akron. And things I know about her, I can tell you. She's an amazing person. And I'm going to try to pull up the rest of her bio in 1 minute. So I can. All right. She is a PhD and is associate professor in the College of Health Professions at the University of Akron. Her professional interest focuses on relational, systemic understanding of substance abuse and mental health issues within the lifespan. She has participated in numerous presentations surrounding the topic of mental health in older adults. And she also continues her clinical practice, part of which has included serving as a team member with an integrated primary care setting, working with older adults and their physicians. She's been part of our GWEP team since 2017, and we want to welcome you and thank you, Rikki. And just a few housing items before we begin. So, please mute yourself during the presentation. To communicate with the group, please use the chat function and share all chats with the entire group. We will have someone monitoring that and responding to your questions. Please make sure your name shows up on the screen as well as your face, so that our ECHO team will become more familiar with each other. One of the points of ECHO is really building a community, working together, and it really helps to have a face if we can do that. During the case presentation, you can unmute to participate in the discussion as you wish. So just so you are aware, today's session is being recorded, and so be aware that the details of the case have been changed to ensure patient privacy. So at this point, I'm going to turn it over to Rikki to begin the didactic portion of our ECHO.
Thank you so much, Margie, for a beautiful introduction. And I'm honored to be here today to talk about mental health among older adults and share a little bit with you all. So presentation today is a topic we could talk about for days on end. So we're going to do just the highlights and talking about depression among older adults and really focusing in on the impacts of social isolation, which has just been definitely exacerbated with our current context in COVID. So focusing in on a little bit to understand that and some of the things that we can be doing as providers and fellow humans to help mitigate some of the impacts of social isolation. All right. So here's me, just in case I'll share a little bit more about myself. I am, this is me, Rikki. I am licensed as a marriage and family therapist, and my focus is on mental health and substance use, and oftentimes the intersection of those two. I work both in the School of Social Work and the School of Counseling at the University of Akron, and I love working in behavioral health and the integrated component of the work that we do. So our presentation today, we'll first talk a little bit about the prevalence and trends of depression among older adults, and then focus in on the impact of social isolation and the intersection of depression and social isolation. And then we'll talk about the special considerations related to depression and social isolation and other mental health issues within the context of current state of affairs in COVID, and then talk a little bit about some strategies about addressing the depression and social isolation among our older adult patients and loved ones. So first things first, let's talk about depression among older adults. We know that this is a prevalent mental health issue for older adults. In the general population, the prevalence rates range anywhere between 1% to 5%. But for those who are health system involved, maybe hospitalized, or who are in a facility of some sort, the prevalence of depression can go up to upwards to 13%, which is quite significant. Meaning, let's be familiar with it and what we can do to help out with this. It's also important to recognize that depression differs among older adults. We know that our older adult patients are at increased risk for depression or depressive symptoms, in part due to the linkage or the overlap, the correlation of depression with other chronic illnesses. Oftentimes, increased chronic illness means increased vulnerability to depressive symptoms. In addition to that, older adults are often misdiagnosed or undertreated. And we're all guilty of this, both health providers and the general public. With oftentimes healthcare providers' perceptions might align with some of the myths that this is part of aging, or why bother treating that, or even among our patients who say, this is just part of aging, why bother? Or who see depressive symptoms as something they don't want to talk about or don't want to address. It's important to recognize and to say it and say it again and say it again, that depression is not a normal part of aging, and that there's symptom clusters that we can be on the lookout for among our patients to be screening for depression with our older adults. And here's just a list of those go-to symptoms that oftentimes cluster around depression. It includes persistent sadness or anxiety, loss of interest, hopelessness, pessimism, feelings of guilt, worthlessness, helplessness, and decrease in energy or fatigue, struggles with making decisions, remembering things, difficulty concentrating, issues with sleep or appetite, and relatedly weight, thoughts of death or suicide, or even suicide attempts, or irritability. The one I wanted to highlight here, in addition to all of those, it includes physical symptoms. So oftentimes among our older adult patients, they'll be presenting issues that are physical symptoms that are linked to depressive symptoms. We just have to dig a little deeper. This includes things like aches and pains or headaches, cramps, issues with their GI tract, and even these are symptoms that just don't ease even with a treatment. So we talked about depression. Let's talk a little bit about loneliness and social isolation among older adults. First things first, let's define them so we're all on the same page. Loneliness, we define that as feeling alone even if there is social context. Social isolation is that lack of social connections. And these two constructs are common among our older adult population. Upwards to 1/3% of adults who are 45 and older report feeling lonely, and upwards to 25% of adults age 65 and older are socially isolated. So we're talking significant numbers here. Those higher prevalence rates, we also recognize that there are reasons why older adults are more at risk for being socially isolated or experiencing loneliness. This includes living alone, grief and loss and multiple constructs, a chronic illness, and hearing loss, leading to that lack of social connectedness. We also know that loneliness and social isolation are associated with increased health risks across the gamut here, including dementia, premature death, heart disease, stroke, increased use of the emergency department or hospitalization, and other increased mental health symptoms, including depression, anxiety, and suicide or suicidal thoughts or attempts. And there's a linkage here between social isolation and depression, such that depression feeds into social isolation, which feeds into depression. It becomes a very vicious cycle for patients that we have to figure out where can we intervene in this particular cycle to help increase the quality of their lives. So considering that there is this linkage, we have this whole pandemic on our hands right now that are exacerbating this linkage between depression and social isolation, particularly among older adults. And so there are some special considerations for us to think about as we're working with this population. In regards to mental health, symptoms are exacerbated due to a number of reasons, including increased stress related to COVID. Just its bare existence is a stressor, in addition to all of the ripple effects of COVID. That uncertainty or feeling of uncertainty related to COVID, what's next, what's going to happen next, can really feed into mental health symptoms and increase them. The potential of physical health or being more vulnerable to the negative impacts of COVID can lead to increased stress and increased mental health symptoms. And then again, increased physical health symptoms as it relates to stress can also feed into those increased mental health symptoms. In addition to that, there's an impact on social isolation. So with COVID, there's increased social distancing, there's an impact on routine. So I think about some of my own patients. This has been the sticking point for us, is that there's been this impact of routine. Can't go get the daily coffee with the guys, or can't go do the daily library trip as they had before. Those being significant factors to increase mental health symptoms. And then there's also the array of losses that we have to consider, not only loss in the form of death of loved ones, but also loss in forms of autonomy, being able to do back to that idea of routine, or even loss of certain roles, depending on where they were pre-COVID and what social distancing has led to. So because of all of those things, we know that depression and social isolation are linked. We know that there's these symptoms and experiences are exacerbated with COVID. What can we do, right? What are some of the strategies that we can consider? And here are just a few, and I encourage you all to please add to it as we talk about it today. As providers, we can engage in universal depression screening among our older adult patients and use ESPERT if needed, screening, brief intervention, referral to treatment. We can also ask about social isolations and make recommendations to our patients about how they can address some of that social isolation. How can they still be connected, even despite all of the restrictions and limitations that COVID has presented. We also can connect with our patients. So this is thinking about identifying creative strategies to maintain appointments, use landlines if need be. Again, a cohort effect, landlines may be an easier way to connect rather than sending text reminders or email reminders. Also, educating our patients to build their empowerment. So this is adding in psychoeducation about stress management and even prevention measures, some of those physical prevention measures like hand washing. And we can engage family members and caregivers in the process of helping address these symptomologies by increasing social connectedness. And In addition to this, some of the strategies that our older adult patients can be engaging in to help improve their well-being, to decrease depression, decrease social isolation, there are plenty of opportunities or strategies out there, and we can offer these up as suggestions for our patients. And it includes taking care of the whole patient. So starting with physical movement, yoga, tai chi, stretching. Some of these things may be a bit more challenging for folks in their home. They may not want to do it on their own. I know I've experienced that pushback for some of my own patients. But talking about what are the options for movement right now. If you're able, getting out and walking just a little, or doing your stretches at home. In addition to that, some cognitive exercises, so building in those crossword puzzles, those word searches, anything like that that gets your brain moving. Relaxation exercises, so helping them learn about the importance of diaphragmatic breath, the ability to use mindfulness to just be in the current moment so that the other components aren't taking over, or even meditation, and practicing that as a regular form of self-care can help calm down our bodies, help calm down our minds. Reading is a wonderful strategy to help improve well-being. It addresses relaxation, cognition, all of those things. And there are so many different options for reading. It doesn't just have to be books from the library, but definitely wanting to read for fun, not just reading all the icky stuff that's happening out there right now, which links to the next strategy, which is limiting time. So this includes limiting time, looking at stressful content, reducing the number of time listening to rumors, the rumor mill about what's happening out there right now, and searching for information from reliable sources. So talking to patients about where are you finding your information and how are you limiting your time and engaging in that information so you take care of yourself. And then also staying connected. So the different ways of staying connected, and different resources out there, including the CDC, the World Health Organization, have all listed kind of different types of ways of staying connected. Here are just a few that may or may not work for folks. One is video chat or engaging on the phone. Another is trying something new within the context of what's safe for our patients, but getting out and trying something new, connecting with folks in a different way. Volunteering, again, within the context of what's reasonable right now. And also, if it makes sense, considering a pet or some other form of connection that can help with our overall well-being. And it's also important for us to consider how are we engaging the family or the caregivers in this process. And here are some suggestions that we can put out there for caregivers and families. First, communicating regularly. It's so important. I mean, it's always important for us to stay engaged, but even in this time of additional social distancing, highlighting the importance of regular communication. This includes regular check-ins, calling, or video chatting rather than texting, and asking, being curious, asking how they're coping, ask them about the routines, what's working, what's not, and encouraging them to engage in activities that they enjoy and engage in those activities with them if possible. And then the other component that we can share with the families to use as they're interacting with our older adult patients is to express their support and appreciation. I think we all need this a bit more nowadays, right? The importance of being kind cannot be overestimated. But helping them with maintaining their medical needs, bringing them a meal, any of those acts of service can be a beautiful way to help mitigate some of that and depression and help with social connectedness. And also asking them for their advice based on their experience and wisdom, going back to showing appreciation and expressing gratitude. It goes a long way. Here are a list of references and resources for you if you want to look into this topic in any more detail. And any questions? Here's my contact information, and I can open it up for questions.